Well, hello, everyone. Indeed, it's a pleasure. Thank you much for taking the time out of your day to attend our little seminar. Hopefully, you'll get something out of it. I thought we would change it around just a little bit rather than talking about macular degeneration as such, do a general overview of what optometry is all about and what you can expect when you see your average optometrist. So, with that being said, I think that we shall get onto the presentation immediately. And I'm just going to get there. Here we are. Okay, and here we are. So, all right. So it's all about staying independent. And I think that all of you know that without your vision, it's probably the scariest thing in life when you cannot see. When you cannot see, you become dependent on everyone. And that is a scary thing. So when you're doing, Corinne, I'm just going to get you here for a second to advance this form. Okay. All right. Just see. We're just getting a few little technicalities worked out here. Okay. Yeah, we're gonna, but we want to have the full presentation here.
Okay.
So just one moment, folks, while we get this together. Yeah. Start from the beginning. Okay, we should have a little button here. There we go. All right. So first of all, before we get started, we have a poll question, and I wonder how many could answer this question for us. How often should seniors have a complete eye health examination? Can you answer that by just simply putting in number one if you want in the chat line, or not? So we'll give you a few minutes to answer that question. And if you can, that would be great. And then we'll move on to our next moment. Okay, I'm just waiting to see how many. Perfect. We're looking good. I'm happy about that. Well, all of you that have answered it thus far are absolutely correct. It is an annual eye examination, which is okay, let's just see here. By advancing these slides. Oh, maybe I'll get you to be the advancer there, Corinne, so you can say it right beside me. Now, a guide to health, to eye examination. So an annual eye examination is most critical. Well, you know, we should really think about an eye examination as almost a physical examination. And I know that some of you may go to the doctor's office and basically see, look at the screen on the chart and think that that's it. But there's much more to it than just looking at the screen and can you read 20/20. Many of you as well, I think it's the age of 75, in order to drive, have to have an eye health examination, and often we get these forms. So it's very, very important that you are able to see. So catching an eye disease early in life is probably the most important thing that you can do to prevent any eye health problem. Yeah. Now, the eye, as we know, are the windows to the soul. There's no doubt about it. And then when people come in, they look at us and say, well, doc, I've had this problem. I'm seeing double vision. One of the first signs of a stroke is double vision. One of the first signs of diabetes is all of a sudden the vision was great. You got a new pair of glasses, and then within months, you cannot see out of these glasses. Sometimes the vision will kind of come and go. I remember that I had a lady in who was having transient losses of vision. Her vision would come and then it would go, and then it would come back and it would go again. And I said, you have a number of heart conditions, and perhaps you should have the carotid artery, which is the two main arteries that are in your neck and feed your vision. And basically, you should have those looked at. And sure enough, it was almost a complete plugging of the carotid artery. And so she had this artery reviewed and excavated, if you will, opened up. And her, of course, her visual problem ended. But most importantly, her life was saved. So it is very important that vision is one of the first signs of whether or not something is going on in the body. Now, as far as Alberta healthcare goes, eye health examinations are covered annually by the government, starting from the age of 0 to the age of 18 inclusive, and also starting at 65 to the end of life. So that is really, really a great thing here in this province. I also have a license in the province of Saskatchewan, and seniors are not covered there. So kudos to Alberta and understanding the importance of regular and early eye examinations to protect the public. Now, also, sometimes we have people that have, for example, red eye, or now with the flu being on, many eye infections. And of course, when it goes through a community or a daycare and you love your little grandchildren, you're hugging them and so on, well, you pick up their little bugs as well. So if we get an eye infection, I want you to know there is a billing called a B900. And basically, eye infections and also other things that may be dangerous to health in general are covered for all age groups. So that includes those between the ages of 18 or 19 and 64. If they have a condition that may be related to the eye, but a medical one, there is a billing that is covered by Alberta Healthcare, so they don't have to pay. So, for example, if you're babysitting your grandchildren and they have an eye infection, which will spread to everybody in the household, you may want to just phone your optometrist and bring those children in, and we can treat that eye problem so that you don't have to sit and wait for 15 hours in our emergency department, of which will probably take you until the next day. You don't want to do that. We've got things to do. Plus, it's too costly in terms of the system. Now, what we wanted to do is go through the various common eye diseases that people will have. So I thought to start out in this particular series of lectures, it would be better to get an idea of the basic common diseases, and then perhaps you could let Heather know of the ones that I speak about today, which would be on your top number list that you would want to have more information about. So we've kind of, as Heather has mentioned at the beginning, given you an idea of what we had programmed, but I thought maybe it would be better coming from yourselves as to what you would like to hear. The first one, and the one we're going to talk about today, but rather decided to go with a broad general thing of the various eye conditions, is macular degeneration. Macular degeneration is the #1 cause of visual loss in Canada, particularly over the age of 55, but it starts much sooner. So as grandparents and even as older people in the population, please make sure that all those little people under the age of 18 are wearing proper sunglasses. Macular degeneration, the effects that affect us later on in life, begin very early. Under the age of 18, kids are 6 times more at risk for UV exposure than older people because their pupils are wide and dilated, and because the lens inside their eye is so clear. So as with sunscreening and sun tanning and all those things, we're much more vulnerable in an early age, but then we deal with the consequences later on in life. So if you want to get your grandchildren or somebody you know that's younger the age of 18, something special, a good pair of sunglasses, not from the drugstore and not from the gas station, but from the optometry office would be a good thing to have. That would be the best present that you could get them. Now, I know that parents say, oh, well, they're just going to lose them. But I say to parents, well, we lose mitts in the middle of winter too. So, and you still keep buying them. So macular degeneration is probably the scariest thing that people really have to deal with, because you don't feel anything. You don't see anything until you see it. And usually it affects the central area of vision. So if you can't move around like you used to and your central vision is destroyed, what are you going to do all day? Now, there are two types of macular degeneration. One leads into the other. The first is dry macular degeneration, which when we do an OCT, that's ocular coherence tomography, where you see advertised and nobody can seem to say the word, so we say OCT. And when we do, it's really an ultrasound of the eyeball, and we go underneath the retina and we look at the retinal layers, and we see that it's kind of like the road city right now with potholes. That's kind of what it's like at the back of the eye. And then all of a sudden, out of the clear blue sky from nowhere, it ends up springing a leak. So if you can imagine, a sinkhole develops and you lose your central vision. So you have friends or relatives or somebody you know to see the ophthalmologist on a monthly basis to get shots in the eye to prevent the bleeding. That is when the dry form has now become wet. So what are we supposed to do? Well, first of all, it's already important to know that we should have UV protection starting very early in life, under the age of 18. And of course, you know, when you see all these little kids in the stroller, you need to really make sure that they have sunglasses on. Even though they pull them off, we just keep putting them on. It's like seatbelts in a car. We get used to it. The other important factors, of course, we all know, is good nutrition is important on many levels. But in terms of vision, it is really important. The old adage that, you know, carrots are going to prevent you from losing your vision. Well, actually, the truth is, it's probably an old wives' tale. Carrots are good with beta carotene, but you'll probably turn orange before you actually save your vision. Because the truth is, things like the antioxidants that you want to protect the retina are really from things like green leafy vegetables. So kale, various things like that are probably even better than your good old carrots, just so you know. Now, of course, eating less fatty food, not having hypertension, not being a diabetic, all of those things help with not developing macular degeneration. The biggest factors are a few things that we need to know about, not to mention what we eat and UV exposure and the importance of not protecting your eye from UV. The other factors that are so much important, of course, are genetics. In other words, if you look at the DNA of your relatives and what has happened before you, it puts you at risk. So I always warn my kids about that. Don't get too mean to your dear old mother, because guess what? I'll get my revenge. You've got my DNA. So good or bad, there you are. So genetics are an important factor. However, one of the most important factors is smoking. If you are still smoking, you need to stop. Because if you're smoking, you may as well forget about everything I said, because you make the advancement of macular degeneration about 6 times more if you smoke. And yes, that also includes pot. Some of us who, you know, come from the era of the days of where, you know, we had to do the P9 and all the rest of that stuff. So pot smoking is just as bad as regular smoking. Perhaps, who knows, maybe even worse. So that's really macular degeneration in a nutshell. But basically, the most important thing is, reason you want to come in is you want to make sure that you're not developing it. You want to make sure that you know what to do. You want to have the necessary scans. And probably one of the most important things I give to people, because you don't feel anything, is a little grid where you easily, from the convenience of your own room, can check to see if your vision has changed. All you have to do is check the grid. And every optometrist out there can give you one of those. You can go online and develop it and get it as well off the internet. But the Amsler grid is one of the most important things to check. Now, moving on to the next thing is cataracts. Everybody worries about a cataract because, I've been doing this for 45 years. And when I started, some of you will remember when I mentioned cataract, it was mentioning like you had terminal cancer. It was terrible because when we removed the lens, we had nothing to put back into it. And you ended up with these thick glasses that made you look like a bug from horrifying. So now we have a lens implant, thanks to, believe it or not, our very famous Dr. Gimbel, Howard Gimbel, who is actually the one that perfected the lens implant so that many of us can see properly, and huge prescriptions that we had before are now neutralized so that you have freedom again and you don't have these thick, ugly glasses that wrecked your nose and caused a lot of problems, and you couldn't see properly. So surgery today with cataract surgery and implants is very, very successful. And I know that a lot of seniors come in because now you have a variety of implants that you can put in, the one covered directly by the government, so there's no cost. Those for astigmatism called a toric, and those, of course, the multifocal lens implant that is like putting a pair of in your eye to correct for distance and close up. It all sounds great, but the best thing for you to do is to make sure that you talk to your optometrist as to which of those options are the best for you. But bear in mind, this I really want to point out to you, when you have a lens implant done, it is so critical that you don't bend up and down and decide to do all these calisthenics that you haven't been able to do because you couldn't see. You need to remain fairly placid, not doing a lot of exercising, bending up and down, shoveling snow for at least the first couple of weeks after you have the lens implant put in. Because you need to understand that if that lens implant, which adheres to the back of the original lens implant, the original lens, if that decenters, there's not much you can do about it. So being careful about that is one of the most important. But today, cataract surgery is no longer the fear it used to be. And remember, it's the lens inside the eye, behind that little black hole. It's like a camera lens, adjusts to things as rays of light come into your eye. And that lens becomes cloudy over time. UV is a big factor there. That's the one that is absorbed. The lens absorbs the UV and it becomes cloudy. Now, glaucoma is kind of called a thief in the dark because you don't really know you have the disease until you lose your peripheral vision. So if you have somebody, you're driving along the road and somebody cut you off, and instead of getting all bent out of shape and giving them a finger and all these different things, maybe you might want to consider they just didn't see you because, well, they haven't had their eyes examined for the ever or for the last 30 years. And maybe they have no peripheral vision. So glaucoma is a disease that's often genetic. It doesn't have to be. It's a disease where you start losing your peripheral field of vision. That is the optic nerve, that little cable that takes all the information and sends it off to your brain. That particular area becomes larger and larger as the pressure is building up inside your eye. There are many things that can cause glaucoma, sometimes an accident. Genetics is often the most common one. Now the surgery today is much better than it used to be. Usually we start with drops though, but the compliance rate with drops, particularly when you don't feel anything wrong, is really bad. So now we've resorted to using laser where we actually open up a little hole so the fluid can drain properly. It's a dangerous disease because you don't feel until it's too late. And that's sad because if you'd come in regularly, you wouldn't have had to lose any vision. Remember, vision, unlike teeth, can never be replaced. And, in many cases, I get called to even hospices where people are dying and they're immune suppressed and a virus attacked their eye. And so I just have to knock off the virus and they can see again. But it just goes to show you how important vision is to the very last day on this planet. So we want to take care of it. Diabetic retinopathy. Well, diabetic retinopathy is probably one of the biggest issues we have as being diabetics over the age of 40. it is probably one of the worst diseases we have that's totally solvable and preventable, but people just don't take care of themselves. So first of all, the history is a big factor we want to look at in terms of diabetes. And if you're a type 2 diabetic, well, most of the time you can do something about it by exercise and watching what you eat. The problem we have in this country is that we eat too much and we don't eat the right things and we don't exercise. So all of those three things are big factors. And of course, if you have heart problems and so on, diabetes just adds to it. And so I say to people, well, when we do the ocular coherence tomography and we can see that there's bleeding on the retinal levels, it is a time long before then, but it is a time that we need to start doing something, because after that, it becomes just a catastrophic event instead of failure. That is, we end up starting to lose our limbs, our heart. Then we end up, in dialysis. And well, great. We've got no feet, no legs, and we can't see. What a perfect ending to what could have been otherwise. So it sounds pretty morbid, but I'm just saying that diabetes is one of the major causes that we have as we get older, and usually over the age of 40. So diabetic retinopathy, again, like bleeding macular degeneration, you will have some of your friends going to the ophthalmologist to get shots in their eyes to prevent the bleeding. So the idea would be that if there's a genetic predisposition and your A1C, so if you are diabetic, really, I always ask patients, what is your A1C? That is the average of your sugar levels when you go to see the doctor. The average of those levels is your A1C. And ideally, if you don't want to have any complications from diabetes, you want to have an A1C of about 6.5. If you are going above 6.5, it's going to be a problem. So if you can lock that in your mind, if you're diabetic, always ask your physician or check it on your health record. What is your A1C? 6.5. If you can lock that in your brain, you'll never have a problem. Now, of course, dry eyes. Calgary, Alberta, I think is the home of dry eyes, and I'm from Regina, Saskatchewan, and I have to say it's much worse. Calgary, I don't know. I just think that because we're kind of in a valley here, everything is just dried out. And so it becomes an issue with so many people. There are a number of factors that cause dry eye. First of all, of course, there's the climate. Aging, the tear flow just doesn't work the way it used to. Of course, our corneas, the other part of our eye, have been subject to a variety of weather conditions throughout our life, including the wind, allergies, and so on. So the best thing to do is actually to see your eye doctor, see what your condition is. Certain medications, for example, if you're on antidepressants, if you are on various thyroid medications, will cause your eyes to become very dry. Further, if you've got certain autoimmune disease, for example, rheumatoid arthritis, you get dry eyes, dry mouth, dry throat, dry everything. So dry eyes, present a lot of symptoms, everything from itching to feeling like you've got gravel in your eye. And what do people do? We rub our eye, because when we do that, we squash the tear gland and squash out some tears, and it feels better for a moment. But it's kind of like rubbing a mosquito bite. You just keep rubbing it and things get worse. So the idea is to come in and let's see where we are, because we don't want to get a condition that's very common with women, and that's called Fuchs endothelial dystrophy, and that's where the constant rubbing of the cornea distorts the cornea, and pretty soon it's almost like an eczema condition of the eye that the lights bother you, you feel totally uncomfortable, you can't see properly, and nothing works. So see your optometrist regarding dry eyes for sure, and that's something when we examine it, we will check for. Most importantly, I wanted to discuss with you a healthy lifestyle. Really, all of these things, are really important upon the lifestyle that you do. Like anything in life, what you did before will come back to haunt you later. I try to warn the young people, but you know how that works. So what do we need to do? Well, let's take another little poll here. And I want to ask you the question, what is the leading cause of injury among seniors? What is kind of the death knell that causes those outgoing seniors to not be outgoing anymore and to give up their quality of life? Can you tell me what that would be on the question and answer or the chat line? Can you answer which one of those is the major cause of injury among seniors? Well, in the essence of time, because I know many of you, if you haven't had your lunch, you probably want to have it. It is number 2 in falling. Vehicle accidents, yes, we're always working on that because, you know, they want to check your vision to make sure you're seeing. But I'm just going to tell you that I don't think that vehicle accidents are the number 1 cause of, especially with seniors. Uh, okay, we get stuck again. All right. For some reason, there we go. All right. So preventing falls. You know, when I have seniors, I've seen many, many throughout the years, of course, after 4.5 decades of doing this. And I have seniors that have been vivacious, outgoing, and whatever else. And all of a sudden they have a fall. And, you know, with osteoporosis and things like this, sometimes things don't heal the way they used to. And so these poor seniors, you know, are in pain because you have to wait and wait and wait to see an orthopedic surgeon and get anything done. So falling is one of the biggest factors that happen to change the lifestyle of seniors. Now, vision, of course, plays into that. Is really important. You know, I just have to preface and say this, that when I talk to seniors, you know, they say, Doc, you know, to lose my vision, I've got really nothing left. And in fact, they say, I know at the age of 80 or 90, I don't have much longer, but if I lose my vision, what am I going to do? I'm dependent on everyone. I'm going to have to get someone to drive me. I can't even see what food to eat. I can't see what's going on. And of course, people say hearing or vision, which is more important? Well, of course, it's bias coming from me, but if you have a hearing loss, you know, you got to be able to see to lip read. And so if you can't see, that becomes a real problem. So it is so important that seniors come in on a regular basis to check their vision from all eye diseases so that we can do early prevention as much as we can. That's number 1. And number 2, of course, sometimes glasses need to be adjusted, and we can do that so you can see better and all fitting properly. It is very important that the prescriptions be done right. I know we have a lot of competition regarding prescriptions and where you can get it online if you want, but really, how important is vision that it's done properly? And sometimes the most frustrating part is that when people have glasses done and they go other than the optometrist, and you certainly can, there's no problem with doing that, except that nobody knows better what your visual limitations are and what you need than the optometrist who just examined your eyes. For example, if you have macular degeneration and you lost your central vision, we're going to adapt something so that you can see better peripherally with some of the new high tech that we actually put a computer on your frame that measures your individual eye and head movement so that you've got good peripheral vision. We know that that's important. Whereas sometimes if you just go and get glasses online or somewhere else, they don't know that you can't see centrally or even in some cases peripherally. So having the right pair of glasses matters so much and how they fit on you. And nobody really knows better than the person that actually has examined your eyes. Uh, of course, many of us are still on the computer for hours at a time. It is important that you have proper lighting. It is best, you know, the worst lighting really to actually be under is the LED lighting. It's terrible. And many of you probably noticed that the new cars today have LED lighting, and it's really hard to see. So if you can still find those incandescent light bulbs, I would probably stock up on those because one day they won't be available. And that actually gives you the best lighting. But the other thing too is to have all lighting about same. Some people want to have it really dark. Well, the glare off of the screen will become really a big problem. Now, in most glasses today, we have a anti-glare protection on the glasses and a blue light filter. Just want to mention a little bit about blue light because you're going to hear all about it. We got to protect our eyes from blue light because blue light is going to destroy our vision. Well, not exactly. Frankly, a blue light of a computer screen, all the digital devices that we might use, is nothing compared to 600 times more from outside. So the biggest price for blue light is by far going to be outside. So when you're out there for your walk, make sure that you have sunglasses on that protect your eyes, not only from the UV, but also the blue light. So most glasses today will have a blue light filter. And how you'll notice that is you'll see kind of a blue iridescent to some of these coatings. Sometimes less than before, you'll see a yellowish tinge to them. Blue light is neutralized by yellow. The thing that I want to just point out to you, some important aspects about blue light. Blue light is actually absorbed by the retinal layers. And what it does is destroy the sleep hormone called melatonin. Melatonin is a hormone that is for sleep and only exists, only place in the body is in the retinal layers. So if you're going to go to sleep and watch the television, you know that there's blue light from the TV. You are going to destroy, the blue light will destroy the melatonin, and you will not be able to sleep at night. So much for that. So if you have your glasses with the right blue light filter, and almost all places today have the right blue light filter and the anti-glare that's combined with it, then that will make your sleeping pattern a lot better. Now, the other thing about digital eye strain, I want to tell you, working on computers and so on, is that you should take periodic breaks. The general rule is after 20 minutes, take a 20-second break and look out at 20 feet. So 20, 20, 20. And to blink more often, because we have found that working on a computer decreases your blink rate, and you've got to blink that tear gland to let the tears out. Working on a computer, we get so immersed in what we're doing, we forget to blink. So it decreases the blink rate probably about by 30%. So it's really important to either put artificial tears or increase the blink rate. Which brings me to my next point about artificial tears. Make sure you always ask your optometrist about the artificial tears to get. When you go to the drugstore, it boggles your brain as to what you should get. And some of them have preservatives in. So if you use those on a frequent basis, you're just going to get symptomatic to the preservatives put into it. So ideally, if you're going to use artificial tears on a regular basis, you probably should look at getting those that have no preservatives in them, and some are better than others. So just ask your optometrist. Now, of course, eating. Well, I already mentioned to you about eating, and you can go to our website, the Alberta Association of Optometrists, and you can go on there and get a healthy recipe book for proper cooking and so on. But really remember this, anything bright and colorful is good for the eyes. That's all I can say. That would be, and natural. So leafy greens, better than your carrot, eggs, which actually have a number of antioxidants in it. You have to watch for your cholesterol level, berries, almonds, and fish. And of course, with fish, we always look at the omega-3s, and that is the fatty acids that will actually not only be good for your heart, but actually improve dryness of your eyes. Now, it goes without saying that exercise is really important. Now, many of us, should we get a Peloton and work like that? Should we go to the gym and so on? The best exercise really that is best on your body, and you can do from day one to day end of your life, is walking and swimming. And those actually get you well lubricated. And I suppose yoga adds into that. If you can sit still long enough to concentrate, that's not anything I could ever do. So I'm not that one off, but for some of you can. anything that's not so hard on pounding the pavement as running, because as running, you probably know that it's really, really hard on the body over a period of time. Intense exercises as well. So just walking, swimming, but 3 times a week is 3 times a week is the general idea to exercise. And of course, what it does is control the amount of weight that you have. It distributes your muscle mass, which is really important. And I know that all of you have heard about Ozempic now, which has been used for diabetes and worked well. And of course, people are trying to use it for weight loss. And yes, it works. But the problem with Ozempic, and now studies are showing, is that what it does is you get rapid weight loss, but you get muscle atrophy. In other words, the muscles are not built up just because you lost all the weight. And so that becomes another issue that they're looking at in terms of bone density, is that it's a decrease in that as well. So, all these placebo or all these fast acting things, because, we live in a world where I want to be perfect like right now. But everything that's worth takes a while to do. And so really, I think the biggest amount of money and the most unsuccessful thing ever that I've seen in my time is weight loss. People will go on a diet to lose all this weight and then finally say, forget it. If I have to live like this, I'm not doing it. And then gain even more back. So the best thing to do is slow, meticulous, and really it is that we eat way too much and eat probably the wrong things. So that's probably the biggest factor in weight loss. But you want to be careful about that because diabetes is a problem, hypertension is a problem, and so on. Now, of course, I've already gone through this about the importance of protecting your eyes, regular eye health examinations. If you have a problem, please don't hesitate to contact your optometrist. All of us are here and very accessible. There's not a long waiting list. You don't have to have a special, how shall I say, requisition to come in and see us. If your family doctor refers you and you're under the age of 65, it would be a B900 and it would be covered. Wear sunglasses all seasons, not just in winter, not just when the sun is bright. And in fact, people don't really understand, but when it's dull and overcast, UV is much greater and more dangerous because of reflection of the water droplets than it is when you have a bright sunny day. You remember those days when you're on the beach, there's no sun around, it's overcast. And the next day you can hardly stand yourself because you're burnt up. So UV contributes to cataracts. The blue light contributes to macular degeneration. And of course, it goes without saying that the greatest area, and this should have been actually a poll question, where on your face is the greatest area of skin cancer? And I'll just answer that for you. Believe it or not, the greatest area of skin cancer anywhere on the body, but particularly on the face, is the eyelids. So if you've got a weird growth on your eyelid, I mean the outer part of your eyelid, or around your nose where the nose pads are going, then you need to absolutely get that checked. Again, eye examinations, we suggest from 0 to the age, starting at 6 months for the first eye health examination. Depending on the circumstances, once children start school, annual eye examination to the age of 19. And remember that eye examinations are covered from 0 to the age of 18 inclusive by the government in this province. And if you're over the age of 65 and over, an annual eye examination is recommended. Sometimes we have to see people a little more often depending on the circumstances. And this is covered by all of your taxpayer dollars that you put into the system over the years. And if you want to find an optometrist, all you have to do is go to our website, the Alberta Association of Optometrists, if there's a particular optometrist you want to see, or and the one closest to you, you can just put your postal code in there and it will come up. When in doubt, you can actually phone the association. They would certainly be happy to tell you. And finally, we just want to talk about a healthy eye checklist, and that is to eye examination on a regular basis. Make sure that you can see. You don't want to fall. It's kind of like the death knell, because the waiting period to get in is so long and the pain is so great. Set your computer up where you have proper light so that light is equal all over the place and not that you're sitting in a dark room with the computer glaring in your face. If you have an eye problem, you can get into an optometrist in most cases that day, and certainly within a couple days for sure. The best thing to do is just phone directly and find out, or you can email. And of course, the proper diet, all fruits, nuts, and vegetables that we used to grow in the gardens of long ago. Well, you could perhaps make your little pot garden and grow it as long as the deer don't get in. That seems to be a problem for me. And get regular exercise. You can just do in your house. You can just get under your couch, tuck your legs underneath there, and do some sit-ups. You don't have to have all the fancy equipment that they tell you about. And most importantly, wear sunglasses all year round in all variety of conditions that we have here in Alberta, and particularly in dull, overcast days. And that is all I have to offer. If there are any questions, I would be very happy to take them. Thank you.
All right. Thank you, Dr. Monea. I will ask you to stop sharing, and I'm going to change our view.
I'm going to stop sharing now, and I'll put the video back on. There we go.
There we are. Awesome. So as you can see, I am in a dark room with a computer in my face. So I will work on changing that. We do have some questions for you. So the first one comes from Polly. Does taking vitamin and mineral supplements such as Preservision, is it AREDS or AREDS 2 formula slow down the development of AMD? I don't know what AMD is either.
Okay, so I'm just going to explain that first of all, yes, here's how it goes. AMD is age-related macular degeneration for a starter, and anything backed by the AREDS 2 study is really, really important to have. Now, you can take lutein, you can take zeaxanthin, you can take it separately, but it's a combination of that together with everything that makes a difference. So if you're going to take Preservision, if you're going to take a Vitalux, we sell a Vitalux Healthy Eyes, okay, and now they have it in a chewable capsule, which makes it a lot easier. But always make sure it's covered by the AREDS 2 study, which is backed by a peer-reviewed clinical trial. The problem with taking it, each individual, people say, I'll take lutein, I'll take zeaxanthin, all the different things, is that it's a combination of all of these things that make the difference. So the truth is, yes, will it prevent it? The answer is no, but what it will do is help in anything progressing. In other words, what it does is it increases and protects the macula. So it is an antioxidant to destroy the free radicals that destroy the macular area, which is your central area of vision.
Okay. We have a second question that comes from Alice. Any foods we should eat or avoid to help with the health of our eyes, in particular macular degeneration?
Well, what you want to do is, again, if you do leafy green raw vegetables, you got it made. And that is, kale. Kale is probably the best one out there. Carrots, yes, are good. Any leafy green vegetable that you can have is raw is better than anything that I know of. The problem is when you start adding, when you cook it, you destroy a lot of the antioxidants that are there. Also, when you add all the fried stuff. So fried, greasy stuff that you get when you go through the drive-thrus are probably the worst that you can get. And so, if you could get a little garden and grow it, and not have the deer eat it like me, well, that would be the best way to go. So anything fresh, if you go to the market gardens and get fresh fruits and vegetables, that's your best way to go.
Okay, and there's a follow-up to that. It says, any eye exercises that you can suggest?
The truth is, there really are no art exercises that will actually work. I mean, I know that people move their eyes this way, that way, and whatever else and make you feel better. Well, okay, but there isn't anything scientific that says it will make a difference. I mean, there are schools of thought that have been around for as long as I have been that said, you know, you can train your eyes by doing this and that. Well, none of them are backed by any peer-reviewed research, and still at the end of the gig, you still have to be able to see to do things. So the number of eye exercise, not really. I think the most important eye exercise you can do is think of your eyes as needing a general health visit and make sure that there is nothing going on in the disease area that could be a problem. And of course, remember, the eye is kind of the window to the body. It's the only place in the back of the eye that we can see how the blood is flowing. So it tells us a really good indication of your general health issues. So, you know, it's not only the window of the soul, it's the window to your health. So that's another reason to come in regularly.
Okay, a couple of other questions for you. When it comes to sitting and watching TV at night, what's the best sort of lighting that you should have?
Well, I know sometimes we like to sit in the dark, but once again, it's probably better to have at least, you know, reasonable light on. Now with the high definition televisions, it's pretty easy to see anywhere, but to have your high definition television in a dark room is probably the hardest you're on, because think about it. Your pupil is trying to dilate because it's dark, and then it's trying to constrict at the same time because of the glare off the television. And so it really becomes a difficult thing. I think to have moderate light is a good thing, and that there's not a great contrast between the two.
So aside one from me on this one, is it better to have the lighting kind of behind the TV or behind you?
Probably behind you would be better than behind the television. But once again, it really depends on what you're looking at, what source you're using.
Excellent. Well, that's the rest of the questions that we have. Is there any last comments that you want to share?
Well, if you're asking me, Heather, I just have to say it's always a pleasure to help educate, and I look at it this way: if we can make a difference in one person's life because maybe they knew what to do or were aware to go and get their eyes examined and didn't know what was covered and what wasn't. Listen, as long as you have an Alberta health card, you are covered annually. And I really have to tell you, the most important thing in life is to see it. And when you can't see, you have no quality of life. And I see it over and over again. And I want to tell you how disappointing it is to me when, and I just saw it yesterday, you know, this poor guy's suffering from cancer. He's terminally ill, and he's lost his central vision from bleeding macular degeneration. Been in for the last 3 years. Oh, man, now what? So.
No, that's okay. We're coming to the end and we can still hear you.
Okay, there we are.
There you are.
I must have done that myself. Anyway, I just want to say that have regular health eye examinations done just because it's important. That's one of the most important things. And I know, again, I say it's biased for me, but you cannot replace vision. So I'm going to say you can replace your teeth. It'll cost you a lot of money, but you cannot replace your vision. And it so defines your quality of life to the very last moment that we're on this planet. So take care of it.